Now we're going to look at some tests, and these tests are basically done for muscle. So I want to actually test how strong somebody's muscle is. Patients came with muscle weakness, and I could actually use this to actually assess like to what extent that condition has actually affected that patient. So I have three ways. This is what is known as a manual muscle testing. We have the dynamometry. We have also the functional strength testing. Okay, so let's look at them one by one. So manual muscle testing is just a clinical method. This one, the examiner is trying to apply resistance to what? A patient. So you are pulling this way, you are telling the patient to pull this way. So to what extent can the patient pull? Do you understand? You now grade it. You understand? So if the patient cannot pull, is 0. If they can pull but only small, is 1. If they can move, like if they can actually pull when you remove the resistance, okay, is 2. If they can move against gravity only, is 3. If they can move even when you applied resistance, is 4. Then if it is 5, how you feel the person's strength is intact. You understand? So advantages, this method is what? Safe, is quick, is inexpensive. All of you guys are just using, you know, your bodies. So about the dynamometry, it's just objective measurement of the muscle force using a device. It could be handheld or the isokinetic machine. This is an isokinetic machine. The handheld one, I also have the picture. In case you guys want to see it, you just comment, right? So the handheld one is portable. We have the isokinetic dynamometry, which is like a large machine that measures strength across a range of motion at controlled speeds. So advantages is what? Quantitative, is reproducible, and it's also sensitive to small changes. Okay, so this one is expensive. Alright. No, requires a trained staff. Then about the functional strength assessment. This one, you're just trying to measure somebody's strength through performance of daily activities. Standing up, on the arm throwing, lateral step up, stair climbing, lifting a box, sit to stand, chest pass, overarm throwing, a lot of things. Okay, so sit to stand test, squat or step up test, timed up and go test, you know, arm coil test. Okay, so all these ones are basically trying to look at the strength, you know, how is the person able to maintain, you know. So advantages actually reflects like a real world, you know, experience. You know, what is the person actually experiencing in real time? Okay, so you know, so that's what it is, right? So that's what it is for, you know, these 3 tests.